My name is Quinn Underwood, and I am the Director of Global Business Development here at Advin. What is our mission? We are looking to reduce barriers to primary care through the provision of digital health technology. We believe that this is absolutely crucial to the improvement of health for communities in developing countries around the world. And why is that? Well, if we look at the World Bank's prediction, 90% of all health problems in developing countries could be solved through the provision of effective primary care. This, of course, is an issue because we have a shortage of 2.3 million physicians, nurses, and other healthcare workers in developing countries who would normally be responsible for providing that care. All of this means that 24 to 64% of all diabetics go undiagnosed, 7 to 31% of individuals don't have access to blood pressure management, and correct treatment is prescribed in only 30% of cases. This is compounded by the fact that 50 to 80% of primary care comes from informal health providers who do not have the education, training, or technology to really provide that effective primary care. More specifically, only 8% of rural Bangladeshis can access government health facilities where most of them receive their health care. So what is our solution? How is Advin dealing with this? Advin's care system is a connected, portable, and intelligent healthcare system embedded with artificial intelligence that allows patients and health workers to monitor vital signs, screen for major non-communicable diseases, and communicate with physicians anywhere in real time, making primary healthcare more accurate, affordable, and accessible. So what is our technology? How are we able to do this? At its core, we have a device that is both portable and has built-in communication platforms and interactive dashboards. Integrated with this is an intelligent platform that provides symptom and health-based diagnostics, allowing us to do that predictive healthcare through the algorithms and artificial intelligence we have on the device. We also have these devices connected to biosensors, which allows us to connect real-time health information in an accurate and efficient manner. All of this information is then sent to a secure cloud server, where we're then able to build out that patient history. Through the device, we also have teleconsultation, which means we are able to connect patients with physicians when necessary, all through the device, which means they're able to receive that consultation in an efficient and timely manner. This, of course, can happen through voice or video, depending on the location and the connection, because each device has that SIM card integrated with it, which means that we really mitigate issues of connectivity. All of this meaning that first care boxers can monitor vital signs and diagnose major health problems anytime and anywhere. Our devices also have that intelligent cloud-based platform that allows us to do patient registration, medical history, primary healthcare diagnoses, that doctor consultation, and provision of mobile prescriptions, all with a lab connection through that one device. So what would that web application really look like, or that cloud-based system provide the doctors and healthcare workers as they use it? So they're able to input information, as we see in the upper left-hand corner, as well as look at the patient and their patient history. In the bottom right, we see a photo of a prescription that could be provided to the patient through the device itself, which means that they don't have to wait to really receive the medication they need, particularly when a lot of these issues are time sensitive. So in 2015, Advin launched JOTNO, a digital health center initiative, a pilot project in 6 rural health centers across Bangladesh. We were able to improve the health literacy for 150,000 individuals, provide 10,000 free health screenings, and 12,196 diagnoses. All of this meant the elimination of preventable hospitalization, patient systems being diagnosed earlier and with more accuracy, digital health referrals to specialists provided in a timely manner, and an increase in health literacy. So more specifically, some of those impact metrics from our pilot project. We were looking at improving diagnostics, reducing costs, creating jobs, and increasing health literacy. Specifically, 65% of patients that used Advin devices were women, 34% were pregnant women that had diabetes, 6% of newborn children were found to have diabetes, and 48% of adults over 35 had hypertension. These were all health issues that were previously undiagnosed and would not have been diagnosed if it weren't for Advin's technology and the abilities of our devices. This culminates in the fact that travel costs were reduced by 60% because the portability of our Advin devices, with more than 6,000 prescriptions issued by physicians. And through those 6 centers, we created 12 direct and 18 indirect rural employment opportunities. And of course, 150,000 rural individuals with increased health literacy. So what is our social impact? We've heard a little bit about what Advin has done. Let's look at where we're going. So by the end of 2018, we'll be distributing 450 healthcare boxes with 13.5 million individuals given access to primary care through Advin devices, a 60% reduction in travel costs, a 90% reduction in long-term healthcare issues, with 2,250 rural jobs created, all of this culminating in the fact that Advin is saving lives. So who are our target customers? We believe that primary healthcare should be easily accessible to anyone, regardless of their location, finances, or status. We're reaching out to rural patients, rural healthcare workers, physicians, ready-made garment factories, and microfinance institutions, all of whom we already have partnerships with and are now looking to scale through. So why now? We believe that developing countries are a perfect market opportunity for us because they are currently unsaturated. Furthermore, 59% of patients in those emerging markets already use mobile health applications or services, meaning that that base of health literacy necessary for the trust in Advin devices is already there. Compare this with a 35% in developed markets. Furthermore, improving health is one of the most important and necessary factors in the development of a country and economy. And Advin is the perfect opportunity to do that, all while providing our customers with value and profit. So let's look a little bit now at the market size. Based on global market, we predict there is a possible market of $27.5 billion for the care boxes and an additional $23.0 billion market for health talk time for a total of $50.5 billion. This is based in part on the fact that there are 1.4 billion rural doctor visits per year in rural areas of India and Bangladesh alone, and 6 million rural doctors and practitioners in developing countries do not have the necessary technology they need to provide primary care in an effective and efficient manner. Really, digital primary care is one of the biggest markets in the world, but it is one of the least recognized, and Advin is perfectly positioned to take advantage of that. We're looking at moving us from a current system of inefficient and incomplete data processing and collection, a visit-focused model with no access provided to those in hard-to-reach places, where things are very time-consuming and costly without the tools to effectively diagnose or screen patients, towards a system where we have efficient and complete data collection and processing. It is consumer-focused and affordable, with on-demand doctors through our intelligent platforms and on-site tools to measure that body information all in real time. And Advin is the thing to take us to that future system. So what is our revenue strategy? We're looking at generating revenue from a large number of places. From our patients, we take commission for each patient that visits and receives help through the Advin device. Commission from the healthcare worker for being able to generate profit for themselves using Advin's care boxes. From physicians for providing them access to the marketplace that we have in rural communities. And microfinance companies who are able to provide them microloans for care boxes and sell health insurance to our marketplace through Advin. This, of course, is in addition to the fact that we will be selling each care box the diagnostics tests that go with each consultation and are consumable, and the talk time through the physicians who are able to, when necessary, provide that expertise to the patients. So let's look at our competitive advantage. Advin is one of the only competitors out there right now that has a developing country focus, which means that our algorithms are training themselves with very pertinent data to our marketplace, which means that even if some of these other competitors move into the developing countries, their algorithms don't have that data or haven't been trained to effectively provide accurate and specific health diagnoses, whereas Advin absolutely can. Furthermore, Advin is able to provide a far more comprehensive view of a patient's health through more than 20 parameters taken or possibly taken with each consultation. Our competitors really just aren't able to provide this same scope. Furthermore, we see that really Advin is positioned with a healthcare focus, which means we're able to leverage current infrastructure to reach a marketplace that otherwise is absolutely inaccessible. So financing from 2015 to 2017, we used bootstrapped capital for all our design and development, pilot testing, partnership development, and for securing sales and agreements. For 2017 to 2019 now, we're looking for a $1.8 million investment. This will allow us to do commercial production, regulatory approval, scaling up with that value addition, research and development, international expansion, and provide us with the working capital we need. All of this culminates in a revenue generation of $39.4 million, the opening up of 2 new country markets through Myanmar and India, the service of 11 million individuals, and 35 million diagnoses made. So what are our key financials and how did we actually get to them, which I think is very important. So you can see a little bit of where we're headed in terms of actual operating profit on the left in the graph, and how did we actually predict this and how are we able to do so accurately. So on the right, we see that through our pilot project, we were able to collect significant data, which allows us to draw pretty ready conclusions about where we're headed financially. We found that for rural patients, there was an average of 1 doctor consultation and 2 health screenings per patient per year, with $7 spent on Advin by that patient per year. In healthcare centers, we found that there was a $5,000 profit per year, and that's profit, with Bangladesh offering the potential for 5,000 centers. Now, this investment of 1.8 million will allow us to access an additional 450 of those, besides the ones we have currently in operation. And of course, we're now moving into ready-made garment factories where there are 4.2 million workers in need of better health conditions in more than 4,000 factories. Advin is currently working in 4 of those factories where we found the same expenditure per worker per year as those of rural patients. So we'd like to thank our partners who have been so crucial in getting us here. Everyone has been really absolutely critical in helping us develop a very needs-based approach to solving these issues and developing the partnerships that we have. Of course, we'd like to thank our team, Winnie H. Wan, Alex Lemberis, and Ellen Metzger for their incredible insight. And of course, the rest of the board themselves for making this all possible. We'd like to thank you for taking the time to listen to our presentation and really say thank you. And we hope dearly that we can work with you in the future to scale up what we think is an incredible opportunity.